welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. How genetic factors are associated with behavioral side effects of GLP-1 weight loss medication. Glucagon-like peptide-1 receptor agonist, GLP-1RA, medications for type 2 diabetes and obesity that have recently been making headlines due to a rise in popularity as weight loss agents have been linked with behavioral side effects. A large population-based analysis in diabetes, obesity and metabolism assessed whether certain genetic variants might help explain these effects. GLP-1RA mimic the GLP-1 hormone in the body that helps control insulin and blood glucose levels and promotes feeling of satiety. GLP-1 binds to GLP-1R on cells in the brain and pancreas. For the analysis, investigators examined common genetic variants in the GLP-1R gene in 408,774 white British, 50,314 white Europeans, 7667 South Asians, 10,437 multiple ancestry, and 7641 African Caribbean individuals. Sleep apnea surgery may lower risk of car accidents more than CPAP, study finds. Sleepiness at the wheel is a significant contributing factor to motor vehicle accidents. A new analysis published in Otolaryngology, Head and Neck Surgery reveals that for people with sleep apnea, getting surgery for their condition may lessen their risk of such accidents compared with using a continuous positive airway pressure CPAP device at night or receiving no treatment. In the analysis of data on 28,32,437 patients with obstructive sleep apnea, 3.4% of patients who underwent surgery were in a car accident at any point following their diagnosis, compared with 6.1% of those using a CPAP and 4.7% of those not receiving any treatment. Can exercise and better diet before surgery be associated with fewer complications? Actively preparing for major surgery by exercising and improving diet, known as prehabilitation, is associated with fewer complications, less time in hospital, and improved recovery and quality of life in adults, finds an analysis of clinical trials published by the BMJ. The researchers stress that the certainty of evidence for all comparisons was generally low to very low, but they say prehabilitation based on exercise, nutrition or exercise combined with other components may be beneficial. Researchers in Canada trawled databases for any randomized controlled trial involving adults preparing for major surgery who received prehabilitation interventions or usual care. They found 186 relevant trials involving 15,684 participants that investigated individual or combinations of prehabilitation components like exercise, nutritional, cognitive and psychosocial support for 7 or more days before surgery. Critical outcomes of interest were complications up to 30 days after surgery, length of hospital stay, and health-related quality of life and physical recovery up to 90 days after surgery. Turmeric, a potential supplement for faster muscle recovery post-exercise, researchers. Researchers in the Epi4 Health Group at the Universitat Oberta de Catalunya have found that turmeric and its related products such as curcumin may be able to reduce muscle damage and inflammation in the musculoskeletal system following vigorous physical exercise. Findings are published in the Journal of the International Society of Sports Nutrition. According to the authors, the possible effects of curcumin include mitigating and combating various issues such as local muscle inflammation and systemic inflammation, as well as oxidative damage resulting from the increased production of free radicals during physical exercise and muscle pain, thus improving the individual's subjective perception of pain and the affected muscle group's range of movement. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.